This is the Mike LaPetri Show. Nassau County property taxes are way too high. That's why you need Reassessment and Evaluation Services, Inc., the #1 tax grievance provider that offers personal service and high success rates. Grieve your taxes now before the deadline on March 1st, 2024. Call today for more info, 516-742-5180, or apply online at reassessmytaxes.com. Good morning, good afternoon, good evening. We have with us Lenny Achan from LiveOn New York, President and CEO. Welcome to the Mike LaPetri Show.
Thank you so much for having me, Michael, and to the audience. Appreciate being here and the opportunity to advocate today and talk.
I'm super excited because for those of you who don't know, LiveOn New York serves a population of 13 million people in the greater New York City area, including Nassau, Suffolk County, Westchester County. LiveOn New York partners with 11 transplant centers and nearly 100 hospitals to ensure that an individual's wishes to donate organs are honored and lives are saved. So organ donation, that's just crazy, Lenny, is like organ donation, I think, to me, is something that's been slowly building over the decades, but still has this pushback of it. The idea of it, it's so hard for procuring organs from someone's body, but the purpose, I mean, the very essence of it, it's very interesting. It's the most resourceful way as we as human beings can be, because those organs are saving other people's lives who are still alive. I mean, this is the point. It's post-death. It's the idea that your body no longer can be used, so why not try to be the best way possible where even after death, you're still helping people?
Absolutely. And that's primarily why the brand is called LiveOn. We're an organ procurement organization, an OPO. And yes, it's been something that people have become more familiar with over the decades. Transplantation, again, is decades old. The science and the ability, when you think about that, right? The unbelievable gift of science and modern medicine to be able to take an organ from a human being and put it into someone else who wants to live on, and then giving that person that legacy of living on is just unreal, right? What should never happen is, beyond all of that, a logistical issue or a process or misunderstanding or an urban myth or legend getting in the way of being able to save someone's life. It is the greatest gift that a human being could ever give to somebody else.
Without a doubt. And I think that's, I'm wondering, do you have, like, what are the numbers right now that show the number of people who donate versus the number of people who need these donations? Do you know that?
Yeah, sure. So let's talk United States first, then we'll talk about New York. In the U.S., there's roughly 110,000 people that are on a wait list, waiting, praying, hoping somebody steps up to say yes to donation to save their life. And that's what it really is. It is a life-saving gift. So there's about 110,000 people on that wait list. The number, obviously goes up and down based on the people headed to that wait list. And we'll talk about that in a second. In New York State, that number this morning, waking up, our friends, neighbors, family, people you may work with, people you don't even know, are on that wait list. And that's about 8,500 people.
Wow.
In both circumstances, whether national or New York, about 80% of that list, 80% of the people are actually waiting for a kidney, which means that many people are on dialysis.
Wow.
If you back that number up, because believe it or not, people might say, 110,000 people, that's not a lot of people. Wow, I thought it was millions. Well, in fact, we talk about it in different ways. And the way we should really talk about it is, how many people do we know are headed to that wait list? How many people with kidney disease? How many people with chronic illness, heart disease, lung disease, GI disease? How many people, which are millions, are chronically ill or acutely ill that are headed to that wait list? And that's why it's so important to get the word out about donation, help people understand and dispel the myths, and understand that this is the greatest gift that you could possibly give that you just can't take with you when you're gone.
What level does it take to get on the list? You're telling me all these different people, these millions that are headed to the list. What does it take to actually get there then?
Yeah, I mean, it's a medical evaluation. So an organ procurement organization, we exist and we stand right there for the families and people who wish to be donors, right? So when you think about the ecosystem has many components to it. There's the donor registry. Okay. The donor registry is where you sign up to become a donor.
Right.
It could be state or national or at the DMV. So there's a donor registry. right? Then there are donor hospitals. You mentioned that in opening. There's 100 hospitals that are in what's called a DSA, a donor service area. And there are 56 organizations like LiveOn New York across the United States. And each of them has this donor service area.
Oh, interesting.
And we're federally designated. So that's how that works. So
you're the exclusive donor
service area.
Organ of the service area. Okay,
Yep.
interesting.
So LiveOn New York for the 5 boroughs, Nassau, Suffolk, Lower Hudson Valley, Westchester. We're the only ones who can work with, hold the hands of that donor family or people who said, I want to be a donor. There's 2 ways to become a donor. There's actually 3 ways, but from a deceased donation standpoint, there's what's called a first-person donor. You're a registered donor. You signed up at the DMV.
Right. That's what everybody knows, right?
Exactly.
You go there, you get that indication, the symbol on your license, and you're an organ donor.
And you say, I want to be a donor, and you knew that way before, God forbid, that day comes, right? The other way, which is the majority of the way for us here in New York, is downstate New York, is your family member or loved one. When that time comes, they say, you know what? I know what Lenny represented. I know what Michael represented. And at the end of the day, I know that they wanted to be a donor. So here's the contrast there. In some states, about 70% or even higher are registered donors. In New York State, by the time we approach a family in the hospital, when that moment comes, that dark moment, that tough moment for that patient or that family member who's caring for a patient who has a grave prognosis, only 20% of the time are they registered donors.
Wow.
So 80% of the time, exactly. So 80% of the time, the staff's got to get a family or a loved one from 0 to 100, closing that gap to say, hey, would you like to be a donor? And our job is to respect the yes or no. Our job is to make sure
there's no pressure in there.
No, we're there to give everyone the opportunity to say yes. That is our, primary mission. Beyond working with community, educating, and getting out there around donation, our true focus, and we'll talk about the logistics, is to hold that family member's hand or to honor that person who basically, like a will and testament, a first-person donor, is no differently than you saying, I leave my car to my friend,
right.
I leave my house to my family. You know what? I leave my organs to the community, to people who are hoping for a second chance at life.
But that's very interesting how the family can make that decision, unlike with your last will and testament. That is based on you and solely you in advance. Otherwise, if you fail to do so, then through state powers and trust law, the state has delegated exactly how your property and assets will be distributed. But yet here, it's the inverse. It's the family can make that decision post death, correct?
No, it's actually the same. So
it is the same.
Yeah, so similar. It's similar. So if you sign up, and this is something that's such a great question, and a lot of people don't realize, and I didn't even know 3 years ago, and I've been in healthcare for 25 years.
Right.
So if you sign up to be a donor,
okay,
nobody could turn that over, just like a will and testament, where if you made a will and left something to somebody, family can't come in after the fact and say, you know what, I think Johnny should get the car, not Sandy, right? Like can't do that. So that's similar in that same regard. And afterwards, you're right. Afterwards, if you're not an organ donor, a family can authorize you to give that gift.
Right.
Which is where the difference comes
Yes,
in.
that's what I mean.
Exactly.
Specifically after death.
Exactly.
The family can now come in and say, no, we'll have his or her organs donated.
Absolutely.
That's tremendous.
Yeah.
And that's unique to really New York and a handful of other small minority states, correct?
It's the beauty of New York. We know a lot of people are like,
I like that.
It's beautiful, right?
I really do like that because I think it's very hard for
gracious.
a person. Think about that. Like a person themselves to make that decision where it's, I mean, to get there, I want to talk more about that, the mindset behind it. But now post-death, the family knows who their loved one is, their character and all. And sometimes it's to make that next step, it's very tough yourself. But having your own family saying, no, this is what they'd want. I think that's awesome. My grandmother was an organ donor. She just passed away last year, and her organs were donated to specifically science and others for help. That's so amazing. For me, she was always somebody. Lenny, I'm telling you, she was always somebody that was just like about what else is my body gonna do?
Yeah.
Like, how do I help live on? And I think that's so cool with your name too.
Yeah.
The name of your organization, where it really does inspire that mentality, where how for those people who are interested in or desire to have that legacy beyond just their family, but now and their work, but now a different avenue to help people live, which is pretty cool if you look at that.
Yeah, and that's right. It's on both sides. It's that full circle of life. We're here to honor anyone who wants to be a donor or not. If they choose not to, that's great and that's fine. But we're here to give that opportunity to say yes, so that yes, they can live on, or in a circumstance of a family, to your point, making that decision. You know what? This is the darkest moment of our life. This is an opportunity to live on, to have that legacy, to help someone else live on.
So walk me through the conversation upon we're talking about with unfortunately you had a loved one that passed away. What's the conversation that ensues, and then how does that work then if a family agrees? How does it proceed then?
So the process is there's those three ways to be a donor, and
right.
One way that I didn't mention is a living donor, which your audience might see or hear about in the news, and people can become a living donor. That's if you're a friend, family, or you go on a list, altruistic people, unbelievably gracious people who, while they're alive, say, you know what, somebody needs one of my kidneys. I don't need both.
Right.
Somebody needs a piece of my liver. I could live without that piece of my liver and save a life.
Which is amazing.
Like, unbelievable, right? That's the third way. The first way we talked about is signing up to be a first person or registered donor. The second way is family or loved ones saying, I know what, John represented in his life, and he'd want to be a donor, and he'd want to give unto others as he'd have them do unto him if he needed it, right? So that's basically that. But the conversation, so the team, let's talk about the team. So LiveOn New York is 350 scrappy, unbelievable professionals. They're nurses, paramedics, EMTs, administrators, executives, physicians, surgeons. And we are spread out across this, unbelievable New York metro region. And there's a team called Family Service Associates who are specially trained to have that conversation with families.
Wow.
And I'm not one of them. I mean, I've been bedside. My background is as an ICU nurse, and then I came up through the administrative ranks over 20 years. But they have that family. So think about that. There are these tragedies in New York, right? New York, every morning we're looking at the case studies and the call-ins and the referrals that come in. So the hospitals call LiveOn New York, or in any other area, call the OPO in that region, and they say, we have a patient who's met certain conditions, who looks like they may have a grave prognosis. We're calling in. LiveOn New York is then assessing that individual, saying, okay, is there a potential for them to be a donor? And in most cases, anybody can be a donor, so that call-in is critically important. That's coming from the donor hospitals. The team is then assessing that and looking at it, and we're deploying staff to the hospital to start to have those conversations with the medical team, the nursing team, but mostly the family. So there's a critical point where our team of Family Service Associates are going out, holding the hands of those family or loved ones, and they've already, in the majority of times, they already have been given that grave prognosis, or that patient, this is an important distinction, that patient has now been pronounced brain dead, which is dead, right? They've died, and the next conversation that's taking place is, would you like to donate? Would you like to, save a life? There are people on the wait list, and there's a special team who are specially trained to have those conversations.
That's got to be super delicate.
Unbelievably difficult work. Absolutely.
So what's the time frame then they say yes?
It varies, but we have to immediately respond, ideally. So
right.
So
because that's what I've seen. Like I've seen where it's got to keep the organs on ice and all that transfer. Yeah. But to me, it's I can't process it. Like how does an organ even stay alive, quote unquote, thereafter leaving the body? I mean,
let's talk about that process. So there's the referral that comes in, step one. Step two is the clinical and logistical assessment of, is this a potential donor? We are then deploying staff to speak to family. If they're already a donor, or if they say yes to donation, we start to work with the medical team and work with the clinical team at that hospital to then preserve those gifts of life. And what does that mean? It means that the patient may stay on that ventilator. The patient may stay on what is then what's called donor support.
Gotcha.
Right? Life support is prior to brain death.
Yep.
Once you're brain dead, it is no longer life support because you've actually died, and then it is donor support. That time period can be hours, it could be days, it could be a week, where the family, the team, everybody's collaborating, saying, you know what, we believe that we can do this or we can do that to optimize those gifts of life. So one organ donor could save up to 8 lives. On average in New York,
crazy.
it's approximately 3 organs per donor. Those are 3 potential people's lives that could be saved by one person. A tissue donor could change the lives of up to 75 to 100 people, a single donor.
Really? So let's break that down.
Yeah.
The top organs that are being, you said the 3 lives in New York.
Yeah.
What are those organs primarily?
Primarily 2 kidneys and a liver. So
2 kidneys and a liver.
the 8 organs in total: heart, 2 lungs, 2 kidneys, liver, pancreas, and intestine.
Wow.
Yeah. And now tissue, that's a whole other world that your audience probably listening today, they're probably a person who might have received the benefit from a tissue donor, but people don't think about it. So if you've gone for a dental procedure,
Yes.
if you've had, a cornea transplant, if you're a weekend warrior or an athlete who blew out an MCL, an ACL, a tendon, right? Many times people think that those replacements, even, part of your spine, right? Part of bone, tissue, skin, burn victims, patients with cancer, especially breast reconstruction, post-breast cancer. All of that you think may be coming out of a box or a bag that's made in a factory. No,
Those are
it's
donations.
actually coming from, in many of those circumstances, it's coming from a donor.
Really? So that's very interesting. So that's how the pieces of yourself are then scattered throughout and being able to assist in various ways. Heart
veins,
yeah,
right. Big. I mean, those are the majority of the time coming from unbelievably gracious donors who said yes to organ donation and or tissue donation, and so they could save up to 8 lives as an organ donor, and that same individual could change the lives of up to 75 people to improve quality.
So you're looking at
of
over
life.
80 people together that you've helped.
Yeah, I mean, gift of sight, right?
Yeah.
Being able to function, walk again, unbelievable from a single decision.
Wow.
Yeah.
I think that's mind blowing. So okay.
Yeah, so that's the process.
Yes.
So now you're working with the family. You're going to the operating room.
Right.
And that unbelievable moment of becoming a donor happens.
Yes.
Where in many times there's an honor walk. The nurses and staff, physicians, and LiveOn staff are lining the hallway while they roll that gracious donor into an operating room. The gift of life takes place. And then there's the procurement of the organs, removal of those organs, only the organs that have been accepted or used. Now, what's happening before that? Before all of the clinical aspect of that's being done, an entire other team is working with a federal list, the wait list, and they're working with a list that no OPO controls. It comes from the national database. That is, for your audience, the way to think about it is this is a list using an algorithm that knows where everybody is in the country, how sick they are, their blood type, all of the physical components of size, weight, everything, and it is matching each of those organs to the sickest patient anywhere that they are. So while our New York community, which I think is the most gracious community on the planet, to your earlier point about that 80% whose family and friends and loved ones say yes, organs aren't a local resource, they're a national resource. So that team is planning and logistically managing planes, trains, and automobiles, timing, whether we're going to drive, fly in a plane, helicopter, whatever it is, to get it to the sickest person on the transplant wait list, where those transplant surgeons all over the country have said yes or no. So they'll go to patient number 1, and the transplant hospital could say yes or no. Maybe the patient's not ready, maybe they're not strong enough, or they have a fever, so they'll move to number 2, move to number 3. They'll go all the way down that list until somebody says, yes, I'll accept that heart. Yes, I'll accept that liver. The operating room's happening, scheduled. They're procuring the organs, and then that team is then making sure the organs are transported all over the country. And our job, LiveOn New York's job, ends at the delivery of that organ, whether it's Florida, Texas, Ohio, New York, all the same person, all the same donor in so many different ways. Our job stops when we deliver it safely to the transplant center while that recipient is waiting for that gift of life to save their life. So we're responsible for all of that. So it's amazing. You might see somebody jump out of JFK with a box. They're in scrubs. They're running into an airport or LaGuardia. Guess what? There's a kidney in that box going somewhere.
Yeah, and they got times of the essence for
Absolutely.
that. Now, so that means, so for our viewers and listeners, the New York donor does not necessarily mean that it's going to exclusively a New York donee. It can go
Correct.
anywhere throughout the country.
That's correct.
Why? How does that? I get what you're telling me about the federal list, but doesn't it make sense to keep it within New York only? Why is it? I mean, why is it where we distribute it throughout the country? Doesn't that make it more riskier
No,
for the
so
organs transporting?
It used to be that it stayed local.
Yes.
And many years ago, they started to change that allocation algorithm, and they started to look at it from a more equitable way. When you look across the United States, and they'd say, you know what, there might be somebody at the top of that list in New Jersey, or the top of that list in Florida, and they may have hours to live.
Okay.
As opposed to somebody local who may have years or months to live. That's an extreme version of how to think about it. And it's calculating that, right, which we have nothing to do with. That's all taking place in the transplant wait list, at the transplant hospitals, by experts, by transplant surgeons and clinical teams. And we're looking at that list, and we're going down it, and it's measuring everything from, okay, this is a kidney. You know what? The kidney has 24 hours that it could be outside of the body. We could extend that up to 36 hours on a special pump.
Wow.
So it's only going to take 4 hours to get to Florida, or 2 hours to get to North Carolina. And it'll calculate all of that based on that, the OR timing, and get it to the sickest person, so that the sickest person in the country has that chance and opportunity to live.
Wow. Yeah. What on this federal list, who is charged with creating this list?
Yeah, so all of these centers are contributing to a massive database, and then OPTN and UNOS have a list. They're the federal contractor that maintains it, and there's an algorithm behind it that issues that list.
Which agency? Is this part of the federal government then?
Yeah, ultimately they're a contractor of HRSA and the federal government, and CMS contractors, but they are in charge of that entire algorithm and list. And it's constantly improving. The allocation process has been in the news a lot lately, looking at how to improve the entire ecosystem. So there are faults and flaws through the system, and a lot of innovation and a lot of technology that can make it better. And there's been tremendous advocacy and a lot of press around essentially completely looking at this and saying, how do you change it all? How do you make it better? Because nobody should die because an algorithm is wrong. Nobody should die because of a lack of a piece of technology. I often, when I talk about this, I talk about, look at this world that we're living in where you could take an organ and put it in someone else or tissue, but what could kill you is getting an organ through traffic from New York City to Stony Brook.
Yeah.
That should never be a problem, right? But the logistical issues are what a lot of people have not focused tremendously on. We're more of a logistics company than a healthcare company. We may run around in scrubs and we may speak clinical jargon and understand we do not practice medicine, right? We are here for the donor, but the majority of what we're doing is actually logistics, and the industry has to get so much better at this to improve the life-saving gifts that could happen from this.
What is LiveOn New York's, some of your recommendations or solutions that you want to see implemented and imposed to address a lot of these concerns? Specifically, something like that. Like, nothing would anger me more if I'm with my father or mother on their deathbed. Unfortunately, they pass. And then now LiveOn New York comes. We have this discussion. And I say, my mother and father are angels, and they're going to want to donate and help out someone in the future. And then they go through the process of giving their organs, and then all of a sudden their organs are wasted because it gets caught in traffic, or this or that, or something happens with a flight, or et cetera. Yeah. That would infuriate me.
Yeah, absolutely. So New York was not always good at this, and we still have a long way to go. So I came to LiveOn New York about almost 2 years now. And for about a decade, LiveOn New York continued to be what's called certified, but they were under corrective action plans, performance improvement plans. New York was in the lower 10th percentile in the country of actually doing everything we're talking about today. So there was a turnaround needed. So the essential ask was to come in, turn it around. It's been very hard to do that. There are logistical issues, cultural issues. There are 40, 50 years of practicing a certain way that when you come in to really try to push through that and disrupt it are very difficult. So there's a long way to go. But we've been able to make significant changes, and in 2022, we were able to increase the amount of organs transplanted, successfully transplanted organs, by about 30%, which is significant.
Yes.
If you look across 22, 23 months, as of like September, we were up about 50% in the amount of organ donors, tissue donors, and organs transplanted. Still a very long way to go, but something that, to your point, what did we do? What changed? Primarily, and a lot of people don't believe this. They're like, Lenny, what happened? What changed? You have a history of innovation, and did you do this, and did you do that? We followed the regs and the laws. So, believe it or not, have we done anything incredibly novel or innovative? No. We looked back at the way this was originally intended, right? And I could make correlations to our founding fathers, and we could go on and on and on for 3 hours about that.
Yeah.
But you know what? They got it right. 30, 40 years ago, and this process started in 1968, and then through the 70s and the early 80s. If you look back at the original intent of an OPO, an organ procurement organization, think about this. Donation isn't a discipline within medicine. It's not like cardiology, oncology. It has no real home.
Yeah.
It doesn't have advocates.
That's true.
There's not a chief donation officer in the hospital. There's no fully dedicated 100% resource to this thing that can save so many lives, right? And I come from the hospitals, right? I'm a hospital operator. I'm an exec. I'm a nurse. I came from that world, spent 25 years there. And so I was the other side of the table. So right now, it's like I'm the prosecutor who was a defense attorney,
yes,
right? The cop who became internal affairs. I understand the other side of all of the issues, and how also as a community member, a minority, a host of other things, I understand all of the issues. As a born and raised New Yorker, I believed some of these urban myths and legends. Can you believe it? Even being a nurse, even being an executive.
Shows you how pervasive they are and powerful.
Absolutely. So, the strategic plan was written for the former me and the former people like me to say, how do we improve this? How do we close the gap? How do we fill in the blank in the sentence? And the answer was, believe it or not, once again, we followed the regs. We followed the law. We looked at the original intent of what this was designed to do, and we realized that in many ways got very far away from it and had to go back to it. And once we did, our gracious, beautiful community met us there, and we were able to increase, pretty significantly the life-saving impact of donation.
And you were talking about these myths, right? These urban myths. Can we, for the viewers and listeners, what are your top 3 urban myths that you were believing, and how do we dispel that to ensure that people don't keep following?
Sure, and a couple things, right? So when I was a nurse in the ICU, just to get back to those myths and legends, when I was a nurse in the ICU in the late 90s, right, early 2000s, and the New York Organ Donor Network, then that's what it was called, LiveOn New York, walked into my ICU, I was pissed because I was trying to figure out, this person passed away.
Yeah.
Why do I have to put all my time and resources into the person who's passed away when I'm trying to keep this other person alive?
It's fair.
Right?
Yeah.
I just didn't know better, right? It wasn't a part of our nursing education. It wasn't a part of the culture orientation. It didn't exist in our ecosystem or infrastructure. So there's a massive opportunity and gap that still, even 25 years later, is pervasive in our community. So that is, one of the single biggest things that we're trying to address. The second thing is, just people understanding that if you were in that bed, to your earlier point, right? If you were there, your family member was in need of an organ, you'd be hoping, wishing, praying, making deals with God to say, please, somebody step up to save this person's life, my loved one's life. But on the flip side, we're not so quick to give. We're quick to receive, right? And I'm speaking as a culture, but we know that when it comes time to ask the families, the New York community steps up. In moments of crisis, the New York community steps up. And that's the big gap that we've seen that's been closing because of positive public sentiment. The media has been a great and strong partner with us. We've been able to get over 4 billion media impressions over 2 years of honoring our donors and their families. There's a flip side to that too, where there's still some ignorance in the community, and I'll get to those urban legends. The 3 big ones that I see, and I'll make the 3 big ones that I not only see, but I probably believed it to the 50th percentile, right? Number one is, my religion doesn't support donation.
Right.
In fact, all major religions support donation. We've talked to every religion. We have representatives of every religion on our team, and we see the data, and we know that every religion has donated in New York, right? We're a melting pot of culture.
Always.
When the conversation happens and it comes down to saving a life, we see that. So that's number one, and anyone out there should speak to their clergy, priest, imam, rabbi, anybody that you need to, and have a real conversation about that. But there's still a big gap out there. But we know that is a myth and legend. The second one is, well, I don't want to sign up to be an organ donor because if I'm taken to an emergency room, they're going to steal my organs. They're not going to save my life, right? Unbelievable. That comes right out of Hollywood. We've all seen the movies. We've all seen the clips. We've all seen the pieces of it. It's just not true. Not in the United States of America. Not anything that I've seen. Not anything that I believe exists. Here's why. The emergency room physicians, nurses, staff, they have nothing to do with transplantation. They don't know you're an organ donor. They don't care if you're an organ donor.
That information is not provided. I thought their information would be on their.
It's on their license if you.
Yeah, but what about their profile? They don't have their.
No, nobody's even looking at it.
Okay.
They're trying to save your life, right?
Oh, that's it. That's priority.
Absolutely.
Like you're here in the emergency department.
Yeah.
Like ER, I have to save your life.
Yeah,
That's
nobody's like, are you an organ donor?
Yeah.
Like right? Yeah, you're brought into an emergency room. They're trying to save your life.
Gotcha.
And I'm speaking matter of factly, and also, as a son of New York and as a son of healthcare, like I'm telling you, that's what happens.
Yeah.
Nobody, and I know better, even in the last 2 years being in this role, doesn't happen. We're the ones that look to see if you're a donor way after anybody's tried to save your life, and now you're moving on and your prognosis is grave. We're the ones who are looking to validate that.
Right.
Nobody's looking at that. So, number two, there's no transplant departments or surgeons anywhere near the ER. So that whole Hollywood scene that everybody has
Like
stuck
they're
in
ready
their head,
to go.
Yeah, like nobody's walking around. Let's talk numbers. Of the 100 hospitals that we have responsibility with, that we work and collaborate with, our donor hospitals, right? Only 9 of them have transplant centers in them.
Oh, wow.
I mean, so right there.
Of the 100.
Yeah. So like right there, and even in those, they're completely separate. No one's roaming around the emergency rooms. There's nothing like
Yeah, because it's not like somebody that's like, I think some people portray it as a vulture.
Yeah.
Where
yeah.
someone just stalking around the rooms and saying, hey, how's this room? How's this room? That's nowhere near the case.
No, it's made for movies. And I'll tell you what, though, our staff are still called vultures, body snatchers. I mean, it's harsh out there, right?
It is.
I mean, it's still a lot. But it's New York. There's a ton of things. We could talk about food. We could talk about fashion. We could talk about anything and have the same conversation. We get it. We've got to close that gap together as a community. And more people see this, the more that they understand it. So that's the second big one, right? So religion's the first one. That's a second big one.
Yeah, the emergency room situation.
Yeah, and then the third one, which I guess I've never really believed this one because I guess as a clinician back in the day, I just knew better. But people say you can't have a closed casket if you're an organ donor. So don't know exactly where that came from, but definitely not true. It's a surgery, like a surgical procedure done in an operating room by clinicians and surgeons and experts. And, they're procuring those gifts of life and, closing you no differently than any other circumstance of surgery. So that's another big one that, believe it or not, sometimes gets in the way of a conversation about donation. But once you speak to the families or loved ones and they get past that, they realize it's something they might have heard or seen in a movie.
Unless now, obviously, what if they donate obviously parts of their face?
Yeah, so that's
then of course those are going to be the
tissue,
circumstance, right?
Exactly. On tissue donation or very extreme circumstances with special procedures like face transplantation or vascular transplantation, that could be different. But that would be a very informed family.
I was going to say, you could work. The family's going to know, though.
Yeah.
If that's something important with the open casket, then the family can decline the tissue donation, but yet the organ donation can still be procured.
Yep.
Correct?
And not only that, yes, absolutely, 100% right. Those are very informed families who totally know that. The other side to that is there are families totally forget organ donation and tissue donation. There are families who donate entire bodies to medical sciences. Right. So there's no funeral in those circumstances, right? But that's where some of these things come from. and we do a lot to try to re-educate the public and get the word out there. It's not true.
Now, with addition to education, is there also financial incentive? Like, does Live On New York, or are there federal programs or state programs that incentivize families or assist families, say, with the grieving process or funeral costs, et cetera,
no,
et cetera? Is
nothing in New York.
Okay.
There are some changes for living donation.
Okay.
Living donation, some changes that the governor signed about a year ago or so to look at certain tax codes and make sure that there's not a disadvantage to being a living donor around expenses. But for deceased donation, any incentivization, anything like that is illegal. And for tissue and for organ
I guess that
donation.
makes sense because your family's then signing on. It's financial.
Yeah.
It's like, we'll just get rid of so-and-so.
Totally. Now, there's foundations, there's organizations that after the fact, could help with transport, or, nonprofits that have foundations that assist families, schooling, or children who have needs, or, again, transportation that might be necessary. Small things like that, but nothing related to the act of donation.
Interesting. I guess at first glance, I thought it might be beneficial, but then at the same time, you're right about how it can become a pirating operation, essentially. Totally. Sadly, and fearfully, that would be the case.
Yeah.
What about how Live On New York functions? Do you receive any public monies, or is it all private donations? Is it a mix of both?
Yeah, the majority of it is public funds, right? So CMS, taxpayers. So it's why we've got to be incredibly responsible. It's a New York City, couple things, right? So 13 million lives. We're one of the biggest OPOs. We've got a ton of challenges, right? And are also turning the organization around. But we're also in one of, if not, I think now the most expensive city in the world, and a massive healthcare economy that makes us incredibly competitive. So some numbers for you. So when on arrival to Live On New York, there was around 209 staff. Now there's 350.
Yeah, that's
so
great.
That's been like a 60% increase in staff.
You betcha.
It's had to be incredibly competitive because, we're competing for nurses and paramedics and clinicians and physicians in a healthcare ecosystem that's probably 500,000-600,000 workers when you just blink at the large systems. So incredibly competitive, big turnaround, a lot of turnover, a lot of change. And the primary reason for that is the organization was failing. And if you are on the transplant wait list, or your family is, or if you are a family who said, I'm giving this gift of life, and to your point, you'd be pissed if you knew that it got wasted. You want the best team and best people possible.
100%.
Not only doing that, but committed to it and there for the right reasons. So there's been a lot of turnover, and we've been able to hire up to increase the amount of staff, also increase parity of pay, right? No differently than we've seen with the nursing and the unions and the things happening.
You're going to need that to attract the best.
Absolutely. And incentivize, right? So if we're hitting our organizational goals, they're excellent employees, and that's critical to the success. You want to make sure, if you're on the wait list, or you want to make sure if you've left this gift, that the best people are doing it. So we've done all of that and remained really competitive, and probably the most competitive time post-COVID. Like, tons of nurses have left, a lot of clinicians.
Huge resignation.
Absolutely.
Yes.
So we've been able to recruit and retain staff and increase at 60% for everybody listening today, for the benefit of the donor and donor families, and the benefit of people on the wait list around the nation. That's been necessary in New York. May not be necessary everywhere, but it's
here.
necessary in New York.
Lenny, I love it, buddy. Now we're in 2024. Your top 3 priorities for Live On New York, what would you say they are to build the organization and take it to the next level?
Sure. So number 1 is continue to look at the origin thesis of why we exist, not get past that. Be here for the donor. Triple down on focusing on our donors and donor family to help those waiting on the wait list. Number 2 is the big logistical hurdles of this beautiful state that we all love, whether it's rain, snow, sleet, and ice, whether it's protests or bridge closings or anything else in the way of getting in the way of the gift of life. I believe that we're increasingly becoming experts at managing logistical issues that are just unparalleled to anything else we've seen around the country, minus the big urban environments. And the third thing is to continue to take what we've messed up or made mistakes on and really do that entrepreneurial process, iterative learning. Take anything that has not worked, throw it away, and scale to the 10th power everything that we've learned over the last 2 years leading here to 2024 and pushing forward to increase donation more than ever in the state. We've done that already. We've increased and, gotten past that already, but sky's the limit. We should never be satisfied, never pat ourselves on the back, and we should constantly be looking at excelling when people's lives are at stake and legacies.
And absolutely, Lenny, that's exactly it, is that I love the fact that your mentality, specifically as president and CEO, is still looking at that donor and saying, no, we got to do this. We have to. There is no room for error. There is no mistake. We have to fill those gaps to ensure that these organs are delivered and lives are saved, both on the fact of the donor who is relying on LiveOn New York to transport these organs and get them there, and then the donee who's relying on receiving them.
Yep.
It's amazing how you have committed yourself to this organization, to revitalizing it, invigorating it, and becoming the next level for the people of New York, and I love it.
Thank you. Got an unbelievable team of professionals. Appreciate the advocacy and everybody listening, and just, think about this today. Think about it. Talk to your family about it. We appreciate you.
Well, Lenny, I think many people are excited to see what's next. They have learned tons, and I really appreciate you coming on the show to educate all of us about what LiveOn New York provides.
Thank you very much. Always a learning experience both ways. I appreciate you all. Take care.
Thanks, bud.
Thank you.